in the 80s, we were mostly focused on treatment.
Sick care.
Our systems, if we were to be honest, were always developed around our doctors and our nurses. We were focused purely on growth of the hospital.
The patient experience was a non-issue. It was not something that was even thought about.
The hospitals were all very focused on how do we continue to survive in the healthcare environment.
Patients came in, you diagnosed their problems, you treated those patients, and you released them.
We weren't even thinking of surveying our patients on their satisfaction with our care.
I don't think we had very good tools at that time to understand what really mattered to the patient.
And we didn't know how to measure our success in really taking care of people.
Now, that's dramatically different.
Today, we start with a focus on the patient, and it changes the dialogue, it changes the conversation.
We continually redesign the way we take care of patients.
We not only consider the patient, we consider the patient's family, we consider the patient's environment, we consider the patient's culture.
Now, patients are coming in and they're much more sophisticated consumers.
Patients are more engaged and actively being consumers because there's much more information available, many more avenues.
Patients coming in today think not only make me better, but make me better in a way that I can understand, and do it in a way that is sensitive to what I want, not necessarily what you need.
The expectations continue to grow because I think the entire industry is improving in that area, and as a result, the bar continues to rise.
The greatest potential for success in moving the bar of improving healthcare is going to be how we engage with the patient around education, around preemptive testing.
Care does not occur just in the four walls of the practice. It transcends their whole life experience.
And I think we're now moving into a direction where population health and keeping you out of the hospital is just as important, if not more important, than taking care of you when you're sick.
Healthcare systems of the future are going to look very different.
We cannot compromise continually striving to have higher quality care and safe care.
We tend in this industry to pull towards our individual silo. What we really need to do is make sure that all of our work is contributing to enhancing patient care, enhancing population management, enhancing wellness care to make sure that our population is as healthy as it possibly can be in this environment.
We are going to learn how to mine all of this clinical data that we have. The difference between the winners and the losers is those who learn how to really use it in a strategic way.
We're in an era that I would call the Uberization of healthcare. And if we don't improve our customer service and we don't use technology to deliver patient care where the patients want it to be, somebody else is going to come in and take it away from us anyway.
We're not only just being given a permission to build the best healthcare system that we can imagine, this simply must get done. What can you go do that's more fulfilling than that?
It is progress. We are not done with this journey. This journey is going to continue forever as to how do we become a better place to work, a better place to practice medicine, and a better place to receive care.